టాపిక్ వస్తున్నాయి కదా ఇక్కడ కదా గుడ్ మార్నింగ్ అండి వస్తున్నా రైట్ ఓకే థ్యాంక్ యూ Good morning everyone. Yesterday I finished part of blood pressure. So the important thing about blood pressure we have seen is its definition. It is the lateral pressure exerted by the column of blood on the walls of the arteries. We have seen what systolic pressure, it is the maximum pressure, diastolic pressure is the minimum pressure. The systolic is during contraction, diastolic means during relaxation. So what are the units of blood pressure, what are the normal values of blood pressure, what is pulse pressure we have seen, what is mean arterial blood pressure we have seen. So what is cardiac output, that is stroke volume into heart rate. Whenever these increases, your systolic blood pressure will increase, and diastolic pressure is dependent upon your peripheral resistance, that is the diameter of the blood vessel. So whenever there is vasoconstriction, your BP will rise. Whenever there is vasodilation, your BPs will be low. And what is blood volume? Everything depends upon the blood volume. The amount of blood is in the vessels, your pressure. If the more amount of blood is there in the vessels, your blood pressure is more. So when it is less, your pressure will be less. Okay, so cardiac output in BP is cardiac output into peripheral resistance. And we have also seen the factors, how the age, body, emotions, gender, diet, smoking, exercise, medications, chemicals, all this will affect the blood pressure. And we have also seen the recording of blood pressure. Indirect method is done in the human beings, and that is palpatory method, auscultatory method and oscillatory method. Yesterday I forgot to mention a word about oscillatory method. Whenever you are raising the pressure, appearance of oscillations is your systolic and disappearance of oscillations is your diastolic pressure. This is not very reliable, so it is not done, but for the sake of saying, we are doing it by 3 methods. That is one of the methods, but it is not practical and it is not reliable and it is not usually practiced. Okay, so always check the blood pressure by palpatory method first. If the subject has got an auscultatory gap, by doing the palpatory method, we'll never miss the auscultatory gap. So in palpatory method only systolic pressure can be measured. In auscultatory method, both systolic and diastolic can be measured. Okay, so these are the devices. What are the precautions you need to take while recording the blood pressure? The cuff should be at the level of the heart. Cuff should be at the level of the heart, and it should be at the 0 level, mmHg, before starting doing the pressure. And how for the palpatory method you should check on the radial artery, but for auscultatory method you put the diaphragm of the stethoscope on the brachial artery. And for palpatory method only systolic can be measured. Auscultatory method both systolic and diastolic, that is the way you put the diaphragm of your stethoscope. Okay, so this is how you do it. Appearance of sounds in the stethoscope is systolic pressure, disappearance of sounds is the diastolic pressure. And I told you, when the blood pressure will, if the blood pressure is more than, if the cuff pressure is more than the systolic, no sounds are heard. When it is just below the systolic pressure, sounds are heard. And when the cuff pressure is below the diastolic pressure, no sounds are heard in spite of the blood flowing through the vessels. So that is the diastolic pressure, and these sounds are called cough sounds. This I showed you, cuff pressure and arterial pressure. The one and the dots is the cuff pressure. This is the cuff pressure, The green one is your arterial pressure. So cuff pressure more, no sounds. When cuff pressure is just below the arterial pressure, blood is flowing and sounds are there. So cuff pressure, this and till here. And when the cuff pressure is below your diastolic pressure, no sounds are heard again. See, first and A and last E, we are not hearing any sounds. We are hearing the sounds here. And how this is your systolic, this is your diastolic. Appearance of sounds is your systolic and diastolic. And the next one is how the intensity of the sounds will change. So first they will be tapping sounds, then they are murmurish, then they are banging, then they are muffling sounds, and then the no sounds. Okay, so what is same thing, cuff pressure below, you don't get any sound because the blood flow has become streamlined. It is not turbulent flow. When turbulent flow means it makes lot of noise, and we are able to pick it up with the stethoscope. So auscultatory gap we have seen. In auscultatory gap means a patient with hypertension will have appearance of sounds, disappearance of sounds, again appearance of sounds and disappearance of sounds. This is the auscultatory gap. So that is why always record by palpatory method first to include this auscultatory gap. So what is the primary hypertension? 90% of us will have hypertension. We do not know the reason, just probably because it is genetic. And secondary is if you have some problems in your kidneys or endocrine problems or vascular problems, we have secondary hypertension. This is what I have told you yesterday. Now regulation of blood pressure. Now our body is amazing. So when the blood pressures are more in our body only will try to get the pressures down. And if the pressures are low, our body itself will try to get the pressures up. These are regulating of the blood pressures. And for this, vasomotor center plays a very important role. Vasomotor center, it is present in the medulla. It plays an important role in the regulation of blood pressure. So there are three types of mechanism: short-term mechanism, intermediate mechanism, and long-term mechanism. So short-term mechanisms are these chemoreceptors and baroreceptors. I'll tell you where these are located and how they will regulate your blood volume and its chemical composition. Chemoreceptors means by altering the chemical composition. Baroreceptors means by stretching. Okay, we'll come to it later. So how they will change the blood volume and its chemical composition. These receptors, baro and chemo, will send the impulses to vasomotor center. Vasomotor center, which will either vasoconstrict or vasodilate. Whenever there is vasoconstriction, means your blood pressures will increase. When there is vasodilation, your blood pressures will decrease. So when they should vasoconstrict, supposing your blood volume is low, your BP is low, so vasoconstriction of the vessels will occur. They will try to increase. Whenever your BP, because of bleeding or some hemorrhage is there, your blood pressure is less. That time there will be BP is low means vasoconstriction should occur to regain the BP. When BP is more, vasodilation should occur because to bring down the BP. So vasoconstriction and vasodilation are done according to our body needs. So when the BP is more, it has to vasodilate. When the BP is less, it has to vasoconstrict. If you remember these two, you can follow these mechanisms very easily. Now coming to the mechanisms, what is hypertension? Anything, this number is wrong, it is 140 by 90. This one is wrong, okay? This is 140 by 90. Anything above 140 by 90 we call hypertension. And anything below 90, if the systolic pressure is below 90, we call it hypotension. Hypertension is your systolic and diastolic, at least just with one reading you don't label them as hypertensive. So 3 readings are to be taken. If the 3 readings are high, then we call them hypertension. It is 140 by 90. Anything above 140 and 90 we call it as hypertension. What is hypotension? When the systolic pressure, when the BP falls below normal limits. Generally systolic pressure will be less than 90. Usually some people maintain pressure around 90 by 60. There are hypotensive patients. Orthostatic hypotension. BP is normal, but whenever we stand up, BP falls. This is called orthostatic because by changing the position, BP is falling. This is postural hypotension. So suddenly BP will fall. Patient has got normal BP, but whenever he is standing, BP is falling. That is called orthostatic hypotension. So these are the 3 words you should remember: hypertension, hypotension, and orthostatic hypotension or postural hypotension. Okay, now regulation of blood pressure. So if you understand this, it is very easy. If you mug it up, you can never understand. You have to understand this. Okay. So there are three types of regulations of blood pressure. Short term. Why is it called short term? It will act within seconds to minutes. As soon as there is some change in our blood pressures, arterial blood pressure, it will act within seconds to minutes. That is why it is called short term mechanism. What are they? Baroreceptor mechanism, chemoreceptor mechanism, and CNS ischemic response. That is short term mechanisms. What is intermediate term? Intermediate means because it will take minutes to hours to act. That is why it is called intermediate term. It is the capillary fluid shift mechanism and stress relaxation mechanism is intermediate term. What is long term mechanism? It will take days to years to act. Mainly the kidneys are very important organ. It is hormonal. Usually because of these hormones, it will take very long. So kidneys play a very important role. Okay, so this is renal body fluid mechanism and renin-angiotensin mechanism. Kidneys play hormones play a role in this mechanism, and mainly kidneys will either excrete or retention of the fluid is done by the kidneys. If it is excreting when the blood pressure is more, lot of fluid is sent out by the kidneys. If the fluid is less, the kidneys will try to hold the amount of fluid, blood volume, which will maintain the blood volume. That is how kidneys play a very important role. This is long term mechanism. Okay, now coming to one by one, just pay attention. So it is easy. Now first I am coming to short term regulation, that is baroreceptor mechanism. So baroreceptors, where are they present? They are present in the aortic arch and the carotid sinus and aortic arch. Carotid sinus is in the 9th cranial nerve, whereas aortic arch is in the 10th cranial nerve. So 9th and 10th. So it will control when the mean arterial blood pressure is between 60 to 200 mmHg range. Mean arterial blood pressure, whenever there is only one pressure mentioned, that is mean arterial blood pressure. Yesterday I told you what is mean arterial blood pressure. It is diastolic pressure plus 1/3 of the pulse pressure is the mean arterial blood pressure. Why is this pressure important? Because it will tell us the pressure head of an organ. So forward movement of blood in the lumen of the vessels. If that pressure is there only, that blood will move. So this is mean arterial blood pressure. And these baroreceptors are very stretch sensitive mechanoreceptors. They are very stretch sensitive baroreceptors. In case of hypertension, these baroreceptors are reset at a higher level. So BP is maintained at higher level. Baroreceptor reflex mechanism is reset at a higher level to maintain BP at elevated level. Okay, short term regulation. Now I am coming to baroreceptors. So I told you where are these baroreceptors present? Baroreceptors are present in the carotid sinus. Can you see here? Carotid sinus and the aortic arch. This is the arch of aorta. So they are present in the carotid sinus and aortic arch. From the aortic arch, they are going via the 10th cranial nerve, vagus nerve, and via the carotid sinus, they are going via your 9th glossopharyngeal nerve. So they are going via your glossopharyngeal nerve. 9th is via glossopharyngeal nerve. So carotid sinus, this are traveling via the glossopharyngeal nerve. 10th are traveling via your aortic receptors are traveling via your 10th nerve. So it is glossopharyngeal nerve and the aortic receptors, aortic arch. So they are traveling, these impulses are traveling via your 10th nerve. Okay, this is the 10th nerve, is the vagus nerve. Whereas from the carotid sinus, these receptors are traveling via your 10th nerve, that is the glossopharyngeal nerve. Okay. So carotid sinus and aortic arch have got this baroreceptors. What do they do? These receptors, carotid sinus, whenever the pressure is more, supposing your arterial pressure is more, so they are very sensitive to stretch. These vessels in which they are located will stretch. These vessels will stretch. So when these vessels stretch, your firing level via 9th and 10th cranial nerve is increasing. The increased firing level, fast firing level will increase via 9th and 10th cranial nerves, and these are reaching your medulla, brainstem medulla, and they go, these impulses are reaching the vasomotor center. So I told you vasomotor center is is the one which controls your blood pressure. So it is reaching the vasomotor center. Vasomotor center it is reaching. Now whenever the pressure is increased, they stretch, this vessel stretch, and there is increased firing level through 9th and 10th cranial nerve to the vasomotor center in the medulla. Okay, the brainstem, midbrain, pons and medulla, three put together are called the brainstem. Okay, so brainstem, vasomotor center in medulla. Okay, now what does this vasomotor center do? Now look at this diagram. So now your BP has increased. Stimulation baroreceptors have stretch receptors, they have got stimulated and they have stretched. So increased amount of impulses are going via 9th and 10th cranial nerve. These baroreceptors are located in carotid, sinus and aortic arch. So when they are stretching, your nucleus tractus solitarius, this is also in medulla, that is also getting stretched. Nucleus tractus solitarius is also getting stimulated. When that gets stimulated, what should it do? It should inhibit your vasomotor center. Immediately nucleus tractus solitarius will inhibit the vasomotor center, inhibition of vasomotor center. So when vasomotor center is inhibited, there will be decreased action on the sympathetic nervous system. So sympathetic nervous system, sympathetic output decreases, sympathetic tone decreases because it is inhibition. When it is stimulation means all this will increase. This is inhibition of the vasomotor center. So sympathetic nervous system stimulation has decreased. Sympathetic tone stimulation has decreased. So what will it do on the blood vessels? Blood vessels should vasodilate. Arteries will vasodilate and veins will vasodilate. So arterial is vasodilation, veins is venodilation. So blood vessels will dilate. So dilate means it will bring down the heart rate. Okay, so when they are, and also the sympathetic tone, so again nucleus tractus solitarius, through these interneurons it is also stimulating the vagus. So stimulating the vagus, when vagus is stimulated, your vagal tone will decrease and there is bradycardia. When vagus is stimulated, from past 2-3 classes I am telling you, this both act in the opposite direction. Sympathetic nervous system inhibition and vagal stimulation. So it will give rise to bradycardia. So bradycardia. So nucleus tractus solitarius, when there is stimulation of the nucleus tractus solitarius, it will also stimulate vagus through nucleus ambiguus, this nucleus ambiguus. Okay, so it will stimulate this. So stimulation of the cardio inhibitory center, CIC means cardio inhibitory center. If you forget that also, you just write nucleus tractus solitarius stimulation will stimulate the vagus. When that is stimulated, your vagal tone, whenever vagal tone increases means your heart rate should decrease, bradycardia. And also when sympathetic system is stimulated, your adrenal cortex is innervated by sympathetic system. It will release some catecholamine secretion. So catecholamine secretion also decreases. Sympathetic through catecholamine secretion decreases. So all this put together, inhibition, sympathetic tone is inhibited here. So inhibition means adrenal medulla is also inhibited. So less of catecholamines will come out. So what is the net effect? Your peripheral resistance will decrease. That means your diastolic pressure will decrease. Pumping action of the heart will decrease and your heart rate will also decrease. All this will decrease. So your blood pressure will fall. So what was the stimulus? Earlier your BP was high. And what is the outcome? BP has become low. How it has become low? Because inhibition of the vasomotor. When BP is high, inhibition of the vasomotor center will occur. And via your vagus also, this will vagal tone, stimulation of the vagus and inhibition of the sympathetic system lead to bradycardia. Now exactly opposite, Now supposing there is fall in the blood pressure. Now your BP has fallen. Now you tell me, if the BP has fallen, your firing level, stretching is very less. When 9th and 10th cranial nerves, your stretching is less. So your nucleus tractus solitarius is inhibited. There it was stimulated. Now here it is inhibited. When this is inhibited, your vasomotor center should get stimulated. Stimulation of the vasomotor center. So sympathetic nervous system is getting stimulated. When sympathetic tone, so your blood vessels will vasoconstrict. Vasoconstrict. Okay? Vasoconstriction and venoconstriction. And adrenal medulla also sympathetic secretion, catecholamine secretion also will increase. Adrenal medulla is also stimulated now. Because this is stimulated, adrenal medulla also will, more catecholamines will release. So when all these are releasing, and again through the heart, nucleus tractus solitarius is inhibited, means your vagus is also inhibited. Vagus is inhibited. When vagus is inhibited, your heart rate should increase. So vagal tone is also inhibited. That means your heart rate should increase. Vagus inhibited. Okay, your heart rate should increase. Okay. So same way, net effect is increased in peripheral resistance, myocardial contractility and heart rate, and the blood pressure increases. So when we are starting your blood pressure, there was fall in blood pressure. That was the stimulus. Response is increase in the blood pressure by vasoconstriction. This is very important, vasoconstriction. And also whenever sympathetic stimulus is stimulated, your catecholamines also will release from adrenal glands. Where are these adrenal glands present? Above the kidneys. So they will also get stimulated and more catecholamines are released. So net effect is all this will happen. Okay. And same thing, whatever is inhibited, your vagus is also inhibited. When vagus is inhibited, your heart rate should go up. Okay, this is your baroreceptor. When the BP is low and the BP is high, you look at this diagrams and make a note, you will understand it. Okay, now coming to chemoreceptors. Where are these chemoreceptors present? They are present in the aortic body and the carotid body. Same 9th and 10th. Okay, and they will control when the blood pressures are between 40 to 100 mmHg range of mean arterial blood pressure. When do these chemoreceptors act? Baroreceptors, when they are sensitive to stretch, and these receptors will respond when there is hypoxia, when the oxygen levels are falling, partial pressure of oxygen, or hypercapnia, when your carbon dioxide levels are increasing. Acidosis, when your pH is increasing, acidosis. pH is increasing. So they act when these things happen, hypoxia, hypercapnia or acidosis. How do they act? Where are they present? Carotid body and aortic body. This is the carotid body. Here if you can see, this is the carotid body and this is the aortic body. Chemoreceptors are present in this. And they are very sensitive to chemical composition of the blood. Any chemical composition, blood oxygen has decreased, carbon dioxide has increased, they will react. So how do they react? So when the BP has fallen, supposing BP has fallen to less than 60 mmHg. So whenever, BP has fallen, so less blood pressure, tissues are receiving less blood. So oxygenation of the tissues has decreased. So less oxygen and more carbon dioxide. So they will stimulate the chemoreceptors. So when the chemoreceptors are stimulated, it will stimulate your respiratory center. This will stimulate your respiratory center. When stimulation of the respiratory center happens, it will stimulate the nucleus tractus solitarius. So it will, when nucleus tractus solitarius is stimulated. Hello? Hello? So stimulation of respiratory, when the chemoreceptors are stimulated, it will stimulate your respiratory center. When respiratory center is stimulated, your nucleus tractus solitarius, oh God, hello, wrong number idi. So respiratory center will, when stimulation of the respiratory center will stimulate your nucleus tractus solitarius in medulla. So vasomotor center is getting stimulated. So sympathetic action. When vasomotor center is stimulated, sympathetic nervous system will get stimulated and there will be vasoconstriction. So your BP should increase, heart rate should increase, and pulmonary ventilation also. Pulmonary ventilation, because respiratory center is stimulated, it will stimulate your pulmonary ventilation. And whenever this is nucleus tractus altarius and nucleus vagal tone is decreased. When vagal tone is decreased, your heart rate should increase via vagus. Nucleus ambiguous via vagus, vagal tone will decrease. So parasympathetic stimulation and decrease in the vagal tone will increase your heart rate. Okay. Next effect is all this pulmonary ventilation. We ventilate very profusely. So a lot of carbon dioxide is given out. Okay, so respiratory center will also get stimulated. So your pulmonary increase in the pulmonary ventilation is happening. And sympathetic nervous system is also getting activated. So when the BP is low, your vasomotor center stimulates. If you remember this word, you can write an essay. Okay, so vasomotor, so these are the net effect. Okay, so whenever this parasympathetic also, your vagal tone, decrease in the vagal tone. Decrease in the vagal tone means increase in the heart rate via vagus. Nucleus ambiguous is via vagus. Okay, this is about chemoreceptors. What are the CNS ischemic response? Whenever your blood pressure has fallen very low, between 15 to 50 mmHg of range of mean arterial blood pressure, this will act. When the mean arterial blood pressures are like this will act. So when blood flow to the vasomotor center becomes decreased. So when the blood supply to the brain has decreased, what will happen? Brain. So vasomotor center is not getting, when the BP is low, blood supply to the brain is also low. When the blood to the brain is low, your vasomotor center is not getting enough blood supply. So there will be ischemia, cerebral ischemia. When there is cerebral ischemia, your carbon dioxide, lactic acid, all that will be accumulated near the vasomotor center. Then the vasomotor center directly responds to this ischemia and becomes very strongly excited. It will provide sympathetic vasoconstriction to the whole of the body. So whenever blood supply to the vasomotor center is less, so there will be accumulation of some lactic acid, metabolites and carbon dioxide. It will respond, the vasomotor center responds directly, that center only will respond directly and become strongly excited, giving rise to sympathetic vasoconstriction. This is our last ditch stand. It is called sympathetic vasoconstriction. Whenever blood flow to the brain decreases dangerously close to the lethal level, we are about to die, no blood supply to the brain. This is the last ditch stand. So sympathetic system will get activated and it will produce vasoconstriction, sympathetic vasoconstriction. This is called last ditch stand. This is the last ditch. If here the sympathetic system is not able to respond, person will die. So this is the last ditch stand. So this is called Cushing's reflex also. Cushing CNS ischemic response. Okay. Now Cushing's reflex. Same thing. Cushing's reflex is what? Whenever there is intracranial, your pressure has increased in the cranium. Increased intracranial pressure means your all the blood vessels are getting compressed in the brain. So when they are getting compressed, that will lead to cerebral hypoxia and hypercapnia. When oxygen is low and carbon dioxide is more, so lot of less oxygen and more carbon dioxide is collected in the blood vessels. Okay, cerebral hypoxia and hypercapnia. This will directly stimulate the vasomotor center, like what I told you. When the blood supply to the brain has decreased, the vasomotor center acts directly and direct effect on the vasomotor center. So what will it do? Vasomotor sympathetic nervous system gets activated and this brings about the vasoconstriction and increased BP. Okay, when there is increased BP through the baroreceptors, I told you when the BP is more, baroreceptors will act and it will bring down the heart rate. This is reflex bradycardia. So that is why any tumor in the brain, intracranial tumors, instead of tachycardia, there is always bradycardia, reduced heart rate. reflex bradycardia via baroreceptors. Okay, so this is Cushing's reflex. It will, whenever blood supply to the brain is less, there will be direct effect on the vasomotor center and sympathetic nervous system gets activated and it provides vasoconstriction. And whenever there is, and there will increase to BP. When increased BP is there, your baroreceptor mechanism will come into play and try to reduce the BP. This is reflex bradycardia, is a good sign of intracranial tumors. Whenever there is any tumor in the brain, it is not tachycardia, but it produces reflex bradycardia. That is the Cushing's reflex. Okay, till here it is just the same like the previous reflex, but here in the end there will be via baroreceptors there is reflex bradycardia. This is Cushing's reflex. Okay, now we are coming to intermediate mechanism. Intermediate mechanism, what are they? Capillary fluid shift mechanism is there. Okay, coming to capillary fluid shift, it is that's why we are saying capillary fluid shift. Fluid has to be shifted from one compartment to the other compartment. So from the, if the fluid is more in the intravascular compartment inside the blood vessels, means it will increase the BP. When the fluid is coming out of the intravascular center to outside to the extravascular compartment, means it will decrease the BP. So it's a very simple way. When capillary pressure falls too low, now the pressure in the capillaries is too low because fluid is absorbed through the capillary membrane. Capillary, the pressure in the, because you are bleeding or some hemorrhage or something is there. So capillary blood is low. So capillary pressure is also low. When it is too low, what should happen? The fluid should come from the extravascular compartment to the intravascular compartment. So fluid is absorbed through the capillary membrane from the tissues into the circulation from the tissues, building up the blood volume and increasing the pressure. So fluid from the extravascular compartment should come into the vascular compartment to maintain your blood pressure. This is capillary fluid shift. So I am not using the words hydrostatic pressure and all. So when the capillary pressure falls too low, we need to have some fluid in the vascular compartment. So the fluid is moving from the extravascular compartment into the intravascular compartment, and it will maintain the blood volume and increasing the pressure. Now supposing when the capillary pressure is too high, what should happen? Fluid is lost out of the circulation. From the intravascular compartment, fluid will come to the extravascular compartment, reducing the blood volume as well as the pressure. So the fluid will move according to our pressures. The fluid will move. When we want the blood pressure to be high, the fluid has to come from the extravascular compartment into the intravascular compartment. When the pressure is too high, it has to move from the intravascular compartment to the extravascular compartment. Everything is upon your blood volume. Blood volume maintains, blood pressures will be maintained. So this is capillary fluid shift mechanism. And one more, stress, this is also intermediate mechanism. Stress relaxation and reverse stress relaxation is called. When the pressure in the blood vessels become too high, what should happen? The blood vessels will keep on stretching, lot of pressure. So blood vessels will keep on stretching. They become stretched and keep on stretching more and more for minutes or hours. When they keep on stretching, I told you, your blood vessels will have a smooth muscle. The smooth muscle in the blood vessel will relax. The pressure in the smooth muscle, the smooth muscle in the blood vessel will relax. So the fluid inside the vascular compartment has gone out. So it will maintain the vascular tone. Vascular tone is maintained. Okay, so pressure in the vessel falls towards normal. So it will keep on stretching. Suddenly the smooth muscle in the blood vessels will relax. So fluid from inside the blood vessel will go out. So the pressure inside the vessel will fall towards normal. This is stress relaxation. And reverse stress happens in okay, this is not there. Okay, so reverse stress will happen in another direction. What is reverse stress then? When the blood flow, when the BP is low, the blood flowing through the vascular compartment is low. Okay, there is not much of stress on the vessel wall. So what will it do? It will pull the fluid from the extravascular compartment into the vascular compartment. It will tighten the blood vessels. It will tighten. When there is lot of pressure, it will stretch. When there is not much of pressure inside the vessel, it will tighten the vessel wall. So tone of the vessel wall is adjusted. So it will absorb more fluid from the outside into the vessel. That is called reverse stress relaxation. Stress relaxation and reverse stress relaxation. So fluid is coming from the outside inside the blood vessel. So this is reverse and stress relaxation by maintaining the vascular tone. Either it is stretching or it is becoming too tight, depending upon the situation. Okay, and long-term regulation. Long-term regulation, kidneys are the one which maintain this. It is a hormonal. So renal body fluid regulation. Renal body fluid regulation. When the body contains too much of ECF, means too much of fluid is there in the body. So when the too much of fluid is there in the body, the fluid keeps moving. It will go into the intravascular compartment also. So what the kidney should do? Kidney should remove the fluid. How? So the blood volume and the arterial pressure rise. Whenever the too much of fluid is there in the ECF, your blood pressure and the blood volume will rise. So it will directly put the direct effect to cause the kidneys to excrete the excess ECF. So kidneys will excrete lot of water. So direct effect to cause the kidneys to excrete the excess ECF. So returning the pressure back towards normal. So this is kidneys. If the fluid, if the blood pressure is low, kidneys will try to retain the fluid. So when the blood pressure is too high, kidneys will remove the fluid. So kidneys play a very important role. This is called renal mechanism. Okay. Last mechanism is Renin-angiotensin-aldosterone mechanism. So this is long-term regulation. Supposing arterial pressure has decreased arterial pressure, what will happen? Whenever the pressure in the arterial pressure is low, a substance called renin is released by the kidneys. This renin will act on the angiotensinogen. Where is this angiotensinogen? It is coming from your liver. So this angiotensinogen is converted into angiotensin 1. Again this angiotensin 1 is converted into angiotensin 2 in the presence of some converting enzyme in the lung, ACE enzyme in the lung. Okay, converting enzyme in the lung. Angiotensin 1 is converted. The angiotensin 2 function is it will act on the sympathetic system to bring about the vasoconstriction. Okay, it will act on your kidneys to bring about the renal retention of salt and water. All this will increase your blood pressure. So whenever your flow is less, kidneys will release renin. I have got a diagram. Let me show you the diagram. It is a long-term regulation. It will take months to years for the kidneys to regulate it. Okay, now supposing renin-angiotensin-aldosterone mechanism. Let me start from here. Okay, decrease in renal, kidneys are not getting enough blood because your blood pressures are low. Kidneys are not getting enough blood. So what will it do when the arterial pressure is low? Kidneys release renin from the juxtaglomerular cells. There are part of cells in the kidney. They release renin. Decrease in the renal perfusion. So kidneys are not getting a good amount of blood supply. So it will, blood pressure to the kidneys is low. So kidneys, when the pressure is, the kidneys will sense it and they will release a substance called renin. Where does this renin act? Renin-angiotensinogen is coming from the liver. Renin acts from the kidney on this angiotensinogen and convert it to angiotensin 1. Okay. Now angiotensin 1 is converted into angiotensin 2 in the presence of ACE inhibitor. Okay. Though this ACE is present in the surface of the pulmonary epithelium and renal endothelium. This ACE is coming from lungs, you remember, and also from the renal endothelium. This ACE is coming from surface of the pulmonary, surface of the lungs and renal endothelium. This ACE is coming. So AS will convert angiotensin 1 to angiotensin 2. Now look where all this angiotensin 2 will act. Angiotensin 2 will act on your sympathetic system, and they bring about the vasoconstriction, increasing the blood supply, vasoconstriction. It will act on the sympathetic system 1. Second, this angiotensin 2 will act on the kidneys. It will act on the kidneys. So, and bring about tubular sodium and water reabsorption. So water and sodium and water reabsorption. Sodium and water is reabsorbed into the kidneys. Kidney have all this juxtaglomerular, what are they? The nephron, part of this nephron. So they are acting on it so that sodium and water are reabsorbed. Sodium, water, chloride are reabsorbed. It is not leaving the kidney. They are all reabsorbed into your blood vessels. From the kidney, this nephrons, it is all going and getting reabsorbed in your blood vessels. Okay? And excretion of the potassium. This potassium will come out. Secretion of the potassium means it will come out via your urine. These are all getting reabsorbed into your blood vessels, because when water and sodium, everything is more, your blood pressures will maintain the pressure. Okay, so again, where else is acting? Angiotensin is acting on the adrenal gland on the cortex. Adrenal gland has got cortex and medulla. It is acting on the adrenal gland, and there will be release of aldosterone secretion. The purpose of this aldosterone secretion is to sodium and water reabsorption. Purpose of this aldosterone is absorbing sodium and water from the kidneys, because kidneys should not lose out water via urine. It has to reabsorb the water. So all this water is getting reabsorbed into the blood vessels. Okay. So sodium, aldosterone function is sodium and water reabsorption. Aldosterone function is this. Okay. Sodium and water reabsorption. Then angiotensin is acting on the vessels, arteriolar vessels, and it is bringing about the vasoconstriction. Sympathetic activity, all vasoconstrictor activity, arteriolar, it is bringing about the vasoconstriction in the arterial blood vessels, increase in the blood pressure, increasing the blood. And also angiotensin 2 will release ADH. Where is this ADH present? ADH is present in the pituitary gland, posterior pituitary. What is the purpose of this ADH? It is also to reabsorb water. Collecting duct. It acts on the collecting duct and it will reabsorb the water, H2O absorption. So angiotensin is a powerful vasoconstrictor. So it is acting on the sympathetic system, it is acting on your adrenal glands, it is acting on the arteriolar vasoconstriction, it is acting on the posterior pituitary and bringing about the reabsorption of the water. Okay. So adrenal cortex aldosterone function is this. ADH function is this. Aldosterone. So angiotensin 2 is a potent vasoconstrictor. It is acting on the sympathetic activity to bring about the vasoconstriction. It is acting on the adrenal glands. It is acting on the pituitary, bringing about vasoconstriction everywhere. So your water is absorbed into the blood vessels. Initially there was less pressure, decreased perfusion, less BP. So all this together, water and salt retention is happening. All this water and salt retention is happening. Effective circulating volume increases. Now the circulatory blood volume is increasing, because all the water is getting absorbed into the blood vessels. So there will be water and salt retention. So effective circulating volume increases. So the perfusion to the kidney increases, because there was less perfusion to the kidney is increasing. By all this less perfusion, initially kidneys were not getting enough blood supply. Now because of all this water, and it is getting enough perfusion. Okay, so this is happening. So this is renin-angiotensin-aldosterone system. And also when sympathetic is activated, here I should have told you, sympathetic is activated means your adrenal medulla, catecholamines are also released from the adrenal medulla. So catecholamines also bring about the vasoconstriction, catecholamines. So though they have not mentioned in the diagram, so catecholamines are increased. So it is acting on this adrenal cortex and also on the medulla. So adrenal medulla, catecholamines are released. They are all powerful vasoconstrictors. So everything will vasoconstrict and they are acting on the kidneys, and the water is all retained in the blood vessels and the perfusion to the kidneys is maintained. Okay, so we have seen this is about all the regulations of blood pressure. So short term regulation we have seen, intermediate term regulation and long term regulation. With this I am done with your CVS, blood and the CVS. Hope I am cleared and you go through these slides. Any doubts, you go through the slides and understand them. Okay.